Hello everyone, welcome to Nursing Insights. So today we will discuss about hypertension. So hypertension or high blood pressure, it is an important medical and the public health problem. There is a direct relationship between the hypertension and the cardiovascular disease. Like if BP increase means there is a risk of myocardial infarction or MI, heart failure, stroke, and also the renal disease. Then hypertension is also called the silent killer disease because people who have it are often symptom free. So that's why the hypertension is called silent killer disease. Then definition. So we all know that hypertension is defined as a persistent systolic blood pressure of 140 mm of Hg or more and diastolic blood pressure of 90 mm of Hg or current use of hypertensive medications. So here is the another definition according to American Heart Association. High absolute risk of hypertension is defined as systolic blood pressure more than equal to 130 mm of Hg or diastolic blood pressure more than equal to 80 mm of Hg or treatment for hypertension. So here the anatomy physiology of the blood vessels and the heart. The blood vessels. So within the blood vessels here have arteries and the arterioles, then capillaries and the sinusoids, veins and venules. So arteries. Arteries is mainly the blood vessels. It's transport the blood away from the heart. And the small arteries or the small section of the arteries is called the arterioles. And the aorta. Aorta is the large artery. Then the capillaries. So capillaries means it's a junction between the arteries and the veins. So the smallest arterioles are break up into the several minute vessels. It's called the capillaries. Blood cells and the large molecules such as plasma proteins do not normally pass through the capillary walls. So the capillaries form a vast network of tiny vessels that link the smallest arterioles to the smallest venules. Then veins. So veins return the blood. So it is a veins. So it return the blood to the heart and they have low pressure than the arteries. So the smallest veins are called the venules. So here in the picture it is artery, this is capillaries, and here it's a vein. Then heart. So heart is a hollow muscular organ. So it is a hollow muscular organ which is located the center of the thorax and it occupies the space between the two lungs and the rest on the diaphragm. So it has three layers, the pericardium, myocardium and endocardium. It has four chambers, right atrium, right ventricle, left atrium and the left ventricle. So here it is superior vena cava, it is inferior vena cava. Here it is the aorta, it is the pulmonary artery, these are the veins. Here it is tricuspid valve and this is bicuspid or mitral valve. So it's all about the heart. Then the most important thing is related to the hypertension is blood pressure. So blood pressure is the force or the pressure that the blood exerts on the wall of the blood vessels. So there have two type of blood pressure, systolic blood pressure and the diastolic blood pressure. So systolic blood pressure and the diastolic blood pressure. So systolic blood pressures when the left ventricle contracts and push the blood to the aorta, then the pressure created in the arterial system, so it's called a systolic blood pressure, which is normal for the adults 120 mm of Hg, and for the diastolic during the resting of the heart when the total blood is ejected from the heart, the light or small pressure is created into the arterial system. This is called diastolic blood pressure, which is normal 80 mm of Hg for the adult. Then arterial blood pressure. So it is measured with a sphygmomanometer and is easily expressed with the systolic pressure written above and the diastolic pressure. Means normal BP how we are writing, like systolic by diastolic is normal 120 by 80 mm of Hg. Then the cardiac output and the peripheral or arterial resistance. So these two are the factors of BP. So cardiac output means the amount of the blood is ejected from each ventricle per minute, which is normal 5 to 25 liter per minute. And cardiac output is regulated by the stroke volume and the heart rate. Means cardiac output, uh, stroke volume by the heart rate, and BP means cardiac output into peripheral resistance. And stroke volume, what is stroke volume? So stroke volume means the amount of the blood is ejected from the each ventricle in per contraction. Okay, so if stroke volume increase means the systolic blood pressure will increase than the diastolic blood pressure, or if cardiac output increase means systolic and diastolic both BP will increase. Then peripheral or arterial resistance. So peripheral or arterial resistance means it's depend on the constriction and the dilatation of the arterioles, means vasoconstriction and the vasodilatation. If vasoconstriction means BP will increase and the vasodilatation means BP will decrease. Then control of BP. So the BP will control by the short-term control and the long-term control. So in the short-term control, there have baroreceptors, chemoreceptors, and in the long-term control, there have RAS system, renin, angiotensin, aldosterone system. Here, the types of hypertension. So there are several types of hypertension. So accelerated hypertension, malignant hypertension, hypertensive urgency, hypertensive emergency, white coat hypertension, transient hypertension, pseudo hypertension, paradoxical hypertension, hypertensive crisis, and isolated systolic hypertension. So accelerated hypertension. In the accelerated hypertension, like suppose the previously BP of a person like 130 by 80 mm of Hg, but recent the BP is more than 140 by 80 mm of Hg or 170 by 100 mm of Hg. So the sudden increase of BP is called, this type of BP is called accelerated hypertension. Then malignant. So malignant hypertension, when there have side effects like organ damage. Like if the BP is more than 200 by 130 mm of Hg, and it may cause retinopathy, then renal dysfunction, heart disease, etc. Then hypertensive urgency, hypertensive emergency. So hypertensive urgency. In the hypertensive urgency, BP will increase more than 180 by 120 mm of Hg, and here does not have any organ damage. But in the hypertensive emergency, same type BP will increase like more than 180 by 130 mm of Hg, but it will cause any organ damage. Then white coat hypertension. So in the white coat hypertension, their transient BP will increase when doctor monitor the BP for a while. Okay. Uh, in the white coat hypertension, it may be like as an example due to the stress or sudden health checkup, like that. Then transient hypertension. So transient means it's lasting for a while. So in the transient hypertension is like a white coat hypertension. So BP will increase for a while in case of CVS or MI, pregnancy. So this type of hypertension will call transient hypertension. Then pseudo hypertension. Pseudo hypertension means it's increased BP which is false, means false BP increase. So it's mainly happen in the old age people. Then paradoxical hypertension. So paradoxical hypertension means sudden BP will increase even antihypertensive drug is going on. So in respiratory or the cardiac conditions, paradoxical hypertension will occur. Then hypertensive crisis. So here same, the hypertensive emergency and the hypertensive urgency both are included within the hypertensive crisis. Then isolated systolic hypertension. So in the isolated systolic hypertension, here the systolic blood pressure is more than equal to 130 mm of Hg, but the diastolic is less than 80 mm of Hg. So in the old age people, it's common. Is this type of systolic hypertension will common. So here the classification of blood pressure. So there have 5 types like normal, elevated, hypertension stage 1, hypertension stage 2, hypertensive crisis. So for the normal, we all know that 120 by 80 mm of Hg. Then elevated. So in the elevated blood pressure, for the systolic 120 to 129 mm of Hg and diastolic less than 80 mm of Hg. Then hypertension stage 1 130 to 139 mm of Hg and the diastolic 80 to 89 mm of Hg. Then hypertension stage 2 systolic 140 or more than 140 mm of Hg and the diastolic 90 or more than 90 mm of Hg. And the hypertensive crisis for the systolic 180 or more mm of Hg and then for the diastolic more than 120 mm of Hg. So these are the classification of the blood pressure. Then the risk factors. So what are the risk factors are there for the hypertension? So age is the higher risk because if the age is more than 55, the person is uh, more prone to the getting means hypertension. For more than 55 years of old people, their systolic blood pressure is 130 to 139 mm of Hg and the diastolic 85 to 89 mm of Hg, and these patients or these persons are having the more chances of getting cardiovascular disease. Then alcohol and cigarette smoking. So it's a common history. If the patient have a history of alcohol consumption and the cigarette smoking, so these people have a risk of hypertension or getting cardiovascular disease. Then diabetes mellitus. So in the diabetes mellitus, the body become resistant to the insulin. So pancreas try to compensate by producing more insulin. So for that, in the blood there have high insulin level. So it will cause the increased sodium retention in the kidney, and which may cause increased blood volume, and that will increase the BP. Then elevated serum lipid level. So when the lipid level or cholesterol level increase in the blood, so it may uh, cause the atherosclerosis, and which create plaque formation uh, within the arteries. So arteries are narrowed, and for that vasoconstriction happen, and for the BP also increase. Then excess dietary sodium. So when there have increased sodium, it will damage the endothelium, and it affects the balance of hormones like angiotensin 2, and it will cause vasoconstriction and also BP also increase. Then gender. So um, in the gender, so it is hypertension is more prevalent in men in young adulthood and also early middle age, 55 years of age. So it is more prevalent in the women. Then family history. So history of a close blood relative like parents or siblings with hypertension is also associated with a increased risk of developing hypertension. Then obesity, so weight gain also associated with increased frequency of hypertension. Then stress. So when people are in stress, they have fight or flight response. So we for that the adrenaline hormone is secreted, and it will cause faster heartbeat, and also the blood vessels also constricted. It will cause the increased level of blood pressure. Then etiology. So within the etiology, there have primary hypertension and the secondary hypertension. So the primary hypertension, the secondary hypertension, both are the type of hypertension based on the etiology. So within the primary hypertension, there have obesity, diabetes mellitus, insulin resistance, stress, dyslipidemia, excessive alcohol consumption. So these are already we discussed in the causes or risk factors. So risk factors, so these are the primary things or primary risk factors which cause mainly hypertension. primarily, but there have the secondary hypertension. So within the secondary hypertension, so what is secondary hypertension means? It is elevated BP with a specific cause, and that often can be identified and or corrected. So in that there have coarctation of aorta. Coarctation of aorta means it's a narrowing of the aorta. Then neurologic disorders. So neurologic disorders like brain tumors, tetraplegia, Guillain-Barré syndrome, and also head injury. Then sleep apnea. So sudden drop in the blood oxygen level that occur in the sleep apnea, which increase BP and also the strain in the CVS system. Then cirrhosis of liver. So scar tissue in the liver compresses the blood vessels and reduce blood flow. Then pregnancy induced hypertension. So these are the causes which are under in the secondary hypertension. Then move to the pathophysiology. So in the pathophysiology, high sodium intake, stress. So these are comes under the primary hypertension. Primary hypertension, which are the main risk factors of hypertension. So it will cause increased sympathetic nervous system activity. Then it stimulate the RAS system activity. Then it constrict the renal efferent arteriole, which may cause the increased filtration fraction. So here the filtration fraction. So what is filtration fraction? So it's a fraction of the renal plasma flow, or RPF, that filtered across the glomerulus. So there have a equation of filtration fraction. So filtration fraction is equal to GFR, glomerulus filtration rate, by RPF. So RPF is renal plasma flow, equal to, like, if GFR normal 120 ml per minute and the RPF is 600, means their average 20%. So if filtration fraction 20%, that means remaining 80% continues its pathway through the renal circulation. So here the filtration fraction is increased. And besides that, decreased natriuretic hormones, which both are caused increased tubular sodium reabsorption. It also causes increased intravascular volume, and that will cause hypertension. Then clinical features. So there have common clinical features like, or symptoms like, fatigue, dizziness, palpitations, angina, and dyspnea. Then move to the diagnostic evaluation. So in the diagnostic evaluation, first and important thing is history collection. So when the patient will come with increased BP, we should collect the history of the patients, like previous history or past history, previously the patient having any BP increase history, means hypertension history is there, then family history is present or not, and also the lifestyle like exercise, salt intake, alcohol consumption, smoking history, and other risk factors also have to record. Then physical assessment. So physical assessment, it helps to identify the mainly causes of the secondary hypertension, which are renal femoral delay. So renal femoral delay, it's mainly assess the coarctation of the aorta. Then enlarged kidney for the polycystic kidney disease. Then abdominal bruits, so it's for the renal artery stenosis, and also the habitus of the Cushing syndrome. Then diagnostic studies. Within the diagnostic studies, uh, we have to analyze the blood protein and the glucose level, blood urea electrolyte and the creatinine level, blood glucose level, then also the HDL and LDL level, then ECG. Mainly ECG here, we can see the left ventricular hypertrophy or coronary artery disease, any type of. Then thyroid function test, T3, T4, TSH test for hypothyroidism and the hyperthyroidism. Then chest X-ray to detect any cardiomegaly, heart failure, or coarctation of aorta. Then echocardium. So echocardium to detect any structural disease like cardiomyopathy, dilated cardiomyopathy, these are. So renal ultrasound to detect possible renal diseases, renal angiography to confirm presence of renal artery stenosis, and the urinary cortisol or dexamethasone suppression test. So it mainly detect the cortisol level within the blood. So this is a type of test. In that test, when it's mainly the blood sample taken from in the morning. So that day before day night, the patient are given one dexamethasone pill to intake, and after that day after, so morning the blood will take for this test to detect the cortisol level for the Cushing syndrome. So management here, they have management like collaborative care. So within the collaborative care, uh, there have the lifestyle modifications. So within the lifestyle modifications, it include weight reduction, DAS diet maintain means DAS means is a dietary approaches to stop hypertension, then dietary sodium reduction and moderation of alcohol consumption, reduce a regular aerobic physical activity, and avoid tobacco use or smoking. Then weight reduction. So weight reduction, it have also effect on lowering of bp for many people, and the weight reduction through a combination of the dietary calorie restriction and the moderate physical activity is recommended for overweight hypertensive patients. Then DAS eating plan. So DAS, it means dietary approaches to stop hypertension. So within the DAS eating plans, there it include the like green leafy vegetables, fruits, then increase fiber intake and drinking lots of water. Then dietary sodium reduction. So within that, less than 6 gram of salt per day or less than 2.4 gram of sodium per day. Then physical activity. So in the physical activity, it is recommended that all adults have a regular aerobic physical activity at least uh, 10 to 15 minutes, and for the 5 days in a week. And within the aerobic physical activity, it include like brisk walking, jogging, swimming to lower bp, and it also helps to promote relaxation and decrease uh, body weight. Then avoidance of tobacco products means, especially for the hypertensive patient, should be strongly advised to avoid tobacco products and also the smoking. Stress management. So it's very much helpful for the hypertensive patients, like relaxation therapy and guided imagery and the biofeedback may be useful to manage the BP or decrease the BP. Then drug therapy. So in the drug therapy, the main aim is to decrease the volume of circulatory blood and also the reduce HbA. So in the within the drug, there have loop diuretics, potassium sparing diuretics, then alpha adrenergic blockers, then calcium channel blockers. So these are helpful for the hypertension, means to treat the hypertension. So here within the loop diuretics, there have furosemide and the torsemide, which mainly inhibit the NaCl reabsorption in the ascending lymph of the loop of Henle and increase the excretion of sodium and chlorine. So here the nursing consideration is to monitor for orthostatic hypertension and electrolyte abnormalities. And for the potassium sparing diuretics, there have amiloride. So it reduces the potassium and sodium exchange in the distal and collecting tubules. So for that, monitor for orthostatic hypertension and hyperkalemia, and contraindicated in patient with renal failure. Then they are also use the alpha adrenergic blockers. So for that, nursing consideration should be reduced resistance to the outflow of urine in the benign prostate hypertrophy. And for the calcium channel blockers, they have like dihydropyridines, and it cause the vascular smooth muscle relaxation, which resulting in decreased HbA and the arterial BP. So for that, nursing consideration should be more, it's more potent for the peripheral vasodilators, and change peripheral IV infusion sites every 12 hours. Then nursing management. So nursing management should be encouraging the patient to do lifestyle modifications, like which include weight reduction, dash eating plan, and regular aerobic physical activity. Then providing basic information on disease process. So it include explanation about the what is the high BP, what are the types of the BP, and what are the causes behind to increase for increasing of BP, and what are the symptoms due to increased level of BP. Improving patient adherence to the treatment, then controlling of blood pressure. So encourage the patient uh, to consult with the dietitian uh, to develop a plan for improving nutrition intake and also the weight loss. Then encouraging self management. So in the self management, like give the guidelines for the any therapy like stress management. Then if difficulty is there, then give the emotional and the physical support. Encourage the patient to take the medications timely, and also maintain all type of things to reduce the BP. Then hypertensive crisis. So hypertensive crisis, uh, previously we already discussed in the types of hypertension. So it is defined as systolic blood pressure more than 180 mm of Hg, or diastolic blood pressure more than 120 mm of Hg. So within the hypertensive crisis, it is categorized as hypertensive urgency if the blood pressure is high without damage of organs, and hypertensive emergency if the blood pressure is high with the damage of organs. Then there have causes. So the causes are renovascular hypertension, preeclampsia, eclampsia, head injury, and the salt-rich diets. Then there have the clinical symptoms like neurological symptoms, hypertensive encephalopathy. So it is a syndrome in which sudden rise in BP, which is associated with severe headache. Then renal symptoms. So within the renal symptoms, it is renal insufficiency. It's from any minor injury to complete renal failure can occur. Then cardiovascular symptoms like aortic dissection can develop, and it will cause sudden like back pain, and reduce or absent pulse also present uh, due to the hypertensive crisis. Then treatment. So for the hypertensive emergency, the therapeutic goals are reduction of the mean arterial pressure, which is 110 to 115 mm of Hg within the first hour of treatment. And like intravenous vasodilates include sodium nitroprusside, JTN, nicardipine. So these are that's are helpful for the hypertensive emergency. Then for hypertensive urgency, oral agents can be given with the goal of normalizing blood pressure within 1 to 2 days. And doses, the fast acting agents such as beta adrenergic blockers, AC inhibitors recommended for the treatment of hypertensive urgencies. Then nursing management. For the nursing management, assess the BP every 2 to 3 minutes during the initial administration of the drugs. So use an arterial line or an automated non-invasive BP machine to monitor the BP continuously, and also the monitor ECG for any dysarrhythmia or sign of ischemia. Then measure urine output hourly. Patient receiving IV antihypertensive drugs, so that may be restricted to bed. It may cause severe cerebral ischemia and the fainting. So ongoing assessment should be essential for hypertensive patients. Frequent neurologic checkups, then including level of consciousness, papillary size, reaction, and the movement of extremities helps detect any changes in the patient conditions. Then nursing diagnosis. So here I have written the two diagnoses, but other diagnosis also there. So here two are the decreased cardiac output related to impaired myocardial contractility as evidenced by elevated BP readings, altered heart rate, and patient reports of fatigue during routine activities. And ineffective self-health management related to lack of knowledge of pathology, complications, and management of the hypertensions. So if you want the other diagnosis also there, and based on the diagnosis you can write the nursing care plan also. Then the complications. So there have several complications due to the hypertension. So it's based on the organ. For in the cardiac, there have LVH or left ventricular hypertrophy and the heart failure. For the cerebrovascular, they have stroke and transient ischemic attack. Then peripheral vascular aneurysm. And for the renal, the serum creatinine level more than 1.5 mg per dl or proteinuria. Then retinopathy, generalized or focal narrowing of the retinal arteries, and hemorrhages also may occur due to the hypertension. Then hypertensive heart disease. So in the hypertensive heart disease, there have several heart diseases like coronary artery disease. So hypertension is major risk for the coronary artery disease. In the older peoples who have aged more than 50 years, the systolic hypertension is a much more important risk factor for the cardiovascular disease than the diastolic cardiovascular hypertension. Then left ventricular hypertrophy. So in that, sustained high blood pressure increases the cardiac workload and produces left ventricular hypertrophy, and here also increase the cardiac output. Then heart failure. So heart failure occurs when the heart compensatory adaptations are overwhelmed, means the heart can no longer pump enough blood to meet the metabolic need of the body. Then cerebrovascular disease. So atherosclerosis is the most common cause of the cerebrovascular disease. So hypertension is the major risk factor for the cerebral atherosclerosis and also the stroke. Then retinal damage. So the retina is the only place in the body where the blood vessels can be directly visualized. So damage to the retinal vessels provides the indication of concurrent vessel damage in the heart, brain, and also the kidney. So that's all about hypertension. I think everyone understood about the hypertension. So thank you.